Good evening, everyone. My name is Dr. ARITRA GHATAK. Good evening, everybody. My name is Dr. ARITRA GHATAK from Sri Sangadeva Netralaya. I'm PGT. I'll be presenting a case on focal retinal pigment epithelial defect in a case of metachondromatosis. We presented with an 11-year-old female with a history of trauma in the right eye 1 month ago that led to vitreous hemorrhage and was diagnosed elsewhere. She presented to us in the outpatient department with a diminution of vision and resolved vitreous hemorrhage. On examination, the vision in right eye was found to be 624, which was improving to 6 by 18 from 18 via pinhole. We did not find any relative afferent pupillary defect, and the anterior chamber was quiet in this patient. Fundus examination, we found a retinal pigment epithelial atrophy in the right eye. On systemic evaluation, we found multiple enchondromas was found in the hand, and genu valgum of the leg was very prominent. The CT scan of the whole body showed multiple eccentric bony projections directed from parent cortex and internal trabeculae, continuous with the lesions suggestive of osteochondromas in the patient. The MRI brain was within normal limits, but segmental CT scan images showed osteochondromas in the iliac crest and the tubular bones. Metachondromatosis is a skeletal disorder affecting the growth of bones, leading to multiple enchondromas and osteochondromas. It is an autosomal dominant condition, and the condition affects the tubular bones, the vertebrae, the small and flat bones. Ocular association as per retinal pigment defect is rare. The systemic examination revealed multiple osteomas in the body. There was no gastrointestinal problem, but the CT scan of the whole body revealed multiple exostosis and was diagnosed as metachondromatosis. The patient was subsequently consulted with an orthopedic surgeon. The strong differential diagnosis would be multiple osteochondromas, but other signs and symptoms of syndromic complex was absent in the patient. Biopsy was not done in a patient. The whole CT scan was helpful to pick up the lesions, and in the family history, she was the only one to be involved. No parental consanguinity was noted, and the patient was referred to the orthopedic surgeon, and she is currently attending school with average performance. Thank you. My references. Thank you.
Heard or seen a case of like this.
Yes, ma'am, sir.
I have not seen or heard of a case like this. So
Yes.
it's a very rare case indeed.
Yes, sir. She presented with an RP defect in the right eye with multiple exostosis of the body.
Thank you. Good case.
Thank you, sir. Thank you, sir.
So, Shomshila, you will close the session.
So I think that we had really challenging cases in this session, really tough cases. Of course, 4 out of 5 were tubercular, I think, or 4 out of 6. And the other 2 also we had, so tubercular again wins the game today, and we lose the game today.
You are sitting in the heart of India.
And all of them really taught us a lot about how we should have a thorough clinical examination, like the sign of nuchal rigidity really opened up the case in terms of tubercular meningitis. So, and your cases with the aphthous ulcers, most likely to be Behçet's. So Dr.
Very
JB
nice
is
cases.
putting 1 lakh on it. So
More than that.
more than, and he's probably right. So yeah, so thank you everyone, and thanks for all the chairs and co-chairs.
We finished in time.
And nobody needs to get up because the next session is also uveitis.
You get a 5 minutes, 5 tea break now. It's 4:54. How much is it?
Okay, so 5 minutes. If you say,
5
bring
minutes.
your tea. 5 minutes to go, get your tea and bring it here.
Is it the same panel?
It's not the